Hello everyone, welcome to English lesson for Year 4 Mainstream Medical Students. This lesson is the Case Studies Part 1. The lesson is prepared and presented by me, Hoàng Thị Hằng. Welcome. This is what we are going to cover in this lesson. The first part is the warm-up, the digestive system. I'll tell you later why. The next part is the reading case study. Number 1, cholecystectomy. Then case study 2, surgical pathology report. Case study 3, colonoscopy with biopsy. And the last part is solving the crosswords about digestive system. Now, let's come to the lesson. Let's start with the 2 activities for the warm-up. I'm giving you 2 activities for the warm-up about the digestive system because the 3 case studies are about this system. Now, I want you to spend around 10 minutes to solve this activity by matching the numbers with the diagram here and the suitable organs. Can you please pause the recording for this time, I mean 10 minutes, before you check the answer? Well, let's check the answer. This lesson is from year 2, so I hope that all of you can complete this exercise within the 5 minutes, not 10 minutes, right? Now let's move to the next part. The accessory organs of the digestion. Continue with the matching exercise from 1 to 10 with the suitable names of organs. Can you please pause the recording for 5 minutes before I'm showing you the answer? Well, let's see the answer. Number 1 is the diaphragm. The diaphragm separates the thoracic cavity and the abdominal cavity, right? The spleen, the liver, common hepatic duct, gallbladder, cystic duct, common bile duct, pancreas, pancreatic duct, and duodenum. Number 10 here, the duodenum. The first part of the small intestine, that's it. From year 4, we need to get used to reading case studies. Why? I think that you need time to get used to this so that when you become doctors, you can get more real case studies. And let's learn the first case study from the digestion, cholecystectomy. Cholecystectomy is a medical term. I won't explain how this medical term is formed because the lesson is from year 2. If you don't remember, I hope that you can open the material from year 2 to check it, right? So the first activity I'm showing, the first exercise of this case study is matching. Can you please match the term with its meaning? You should spend around 6 to 8 minutes to complete this exercise. Can you please pause the recording for the given term? Now, let's see the answer. Number 1, a medical term with itis means inflammation, 1C. 2, gram is the image. That's an X-ray image. 3, 4 is an adjective. Lapa means abdominal wall, is the root. 5, 6, we've got pre and post, pre-operative and post-operative. For example, post-operative care. The post-operative care in this hospital is good enough for all patients to recover in the lowest term. 7. Good job. Now let's move to the keywords given in this case. Can you please give the meaning or explanation of the keywords given here? I'm going to give you 10 minutes. Alright, now let's check the answer. Nausea and vomiting. Nausea means the feeling of wanting to vomit, and the action of vomiting means you are pushing something from your stomach out. This means that food goes the wrong way, right? Flatulence and eructation. We've got the different ways to give the temperature, Fahrenheit and Celsius. Rebound tenderness, Murphy's sign. You got all the meanings, everyone? As the normal colors of our stones, light yellow to brown. Maybe sometimes if you eat some specific fruit or some kind of medicines, your stones may change the color based on the food or the medication that you take, right? But if you keep the normal regime of food and medication and your stone comes to the different color, the stones may notice some kind of diseases. The normal white blood count from 4,000 to 11,000. The below or above this normal range may give the signs of some problems inside our body. Well, that's it for this slide. Let's move to the next part. Cholecystectomy. Can you please give me the definition of this medical term and then the types of surgery? How many main types of surgery are there nowadays for the organs in the abdomen? How to perform those types of surgery and why the surgery is carried out, some risks and complications, how to prepare for the patients, and as a doctor, what should you prepare for the typical kinds of surgery. Now you are giving 10 minutes to give me all the answers for the keywords here. Now I'm showing you some ideas about the cholecystectomy. We've got laparoscopic cholecystectomy and open cholecystectomy. The purposes here. If you cannot follow me, don't forget to pause the recording to read and understand all the things I'm showing you on this slide. Okay, everyone? Now, I want you to spend some minutes to give me some comparison between the minimal invasive cholecystectomy and the traditional cholecystectomy. I'm giving you pictures. I took it from Google to see how different they are. Now please pause the recording. Let's see the answer. Can you please visit the YouTube to watch a short video about this part before you are doing the case study reading, okay? Let's start doing your reading case study number 1, cholecystectomy, and I want you to solve the 3 questions here from your materials. Now, let's check the answer. Number 1, C. 2 and 3, nasal gastro, right? Moving to the case study number 2, surgical pathology report. 3 questions are given to you. What is pathology? What is surgical pathology? And what is a pathology report? Now, answer. Pathology is the study of diseases, but surgical, that is related to the examination of tissue removed from living patients to identify a disease and determine treatment plan. And a report. After the examination, we've got this kind of report. Hemorrhage and hemorrhagic, histopathology and histopathologic meaning. I'm showing you some words with their meanings. You can pause the recording for better understanding before we are doing the case study reading. Alright, now, case study number 2, surgical pathology report, with 3 questions given. You can spend around 5 minutes to solve this exercise. Now, let's see the answer. Enteric. Enter means intestine. 5D and 6A. Right. Now, moving to the next one, colonoscopy with biopsy. I'm showing you the image of the large intestine. Here, the appendix, ascending colon, transverse colon, descending colon. We've got fascia, hepatic, near the liver, and splenic, near the spleen. Now, can you please spend 5 minutes on this exercise? Please pause the recording. Let's check the answer. Barium enema, not enema. Right? Got it? Now, let's move to the next part, colonoscopy. Definition. Remember, the suffix is scopy, not scopic or scope. The procedure. The purpose of this is to detect changes and abnormality in the large intestine and in the rectum. The tube, the device is a long flexible tube so that it can get the path through the colon. Well, some keywords given to you. You can pause the recording to read the words in the slide. Can you please click on the link here to watch the short video about colonoscopy and then move back to our lesson. Why should you watch this video? To know more about the procedure. Alright? Now let's move to the reading part. You will have better understanding after you have watched the videos. I'm sure about this. Now, please complete this exercise from question 7 to question number 13, and you have 10 minutes. I'm showing you the answer. I don't have the further explanation for the answer because the exercise is quite easy for you, right? Now more practice. 15. Right upper quadrant. We have right upper quadrant, left upper quadrant. And right lower, left lower. NG, nasogastric. IBD. Please pause the recording to complete this exercise by finding suitable breaths. 10 minutes is given for this exercise. Now I'm showing you the answer. Well done, right? Well, we have gone through the 3 case studies in our lessons about digestion. Now for the post-reading part, I want you to complete this activity by solving the crosswords. You are given around 15 minutes to complete these crosswords. And now, I'm showing you the answer. Well, we are coming to the end of our lesson. And I hope that from now on you will read more and more cases so that you got good preparation when you graduate from our university. Don't hesitate to contact me via phone or email. And I hope that this lesson is useful to you. And goodbye and see you in the other lessons. Thank you everyone. My name is Hoàng Thị Hằng. Goodbye.